Well, I am here on ground in South Delhi in one of the laboratories, and what we are talking about is, of course, coronavirus. That it's an health emergency in India. Yesterday, 2 cases were detected in Delhi and Telangana, and of course, Health Minister Dr. Harshvardhan also took a press conference mentioning about increasing the scanning at different airports, and of course, considering tourists from various other countries who are traveling. I am joined by Dr. Arjun Dang, who is here with me, and we will be today talking about the facilities and resources that are here in laboratories across India, and if we are ready to tackle this problem, I'd say, since it's something that's been increasing day by day, globally has become a problem. Dr. Arjun, tell me that is India firstly ready for this?
So I would say that the Government of India and the Ministry of Health has taken a lot of good measures in order to contain the situation, starting from the screening at airports to the multiple government institutes that are authorized to do the testing currently. We are well equipped. But yes, the need of the hour is to increase the testing facilities as well, as the government has promised, and also increasing bandwidth by allowing private players also to participate in quality testing processes.
Right. Arjun, also tell us that, keeping in mind that there have been 5 cases yet that have been detected in India, and we learn that currently only the government centers have, the kind of resources that can be taken up, or I'd say the permissions to look into this. So in terms of private laboratories, do we have the resources and the problem is with the permissions, or do you think we can wait for a while and watch until, of course, the need of it increases?
Exactly. We will wait and watch till the need of it increases, but we should be well equipped. As citizens of India, we need to work together without panicking with the resources that we have to put our best foot forward. But yes, the quality of testing should be maintained because this is extremely important, and even the safety norms that are followed in a lab, especially while testing for corona, are critical, along with trained manpower, quality reagents, and also maintaining proper documentation so that patients who test positive can not only be informed to the government but can also be followed up for further quarantine and follow-up purposes.
Right. Well, if we talk about Delhi, and if we talk about the laboratories, as a private laboratory, and of course we are here in Dr. Dang's, so have you been getting a couple of queries regarding this? I mean, is there still panic among people, and is that being shown in terms of their approach?
Yes, definitely. I would say we are getting more than several calls every day inquiring about if we are testing for corona, because the issue, the anxiety is caused because the symptoms majorly overlap with the normal flu. So it starts with fever, with cough, with shortness of breath. So again, it is mimicking the swine flu that is anyway rampant these days. And now people are reading about the coronavirus and seeing it on television channels. So they are obviously more aware of the problem. So yes, we've been getting a lot of queries.
Right. And also, how long does it take usually for a laboratory to, assess the problem and get done with the report? Is it a mere process of 24 hours, or is it something that, takes a while to be confirmed, keeping in mind that it also took a lot of while for China to come out with this, the symptoms of coronavirus, and to come out with, yet the cure is not out, but to come out with a proper confirmed, way out to tell that it's happening?
Yes, definitely it would require 2 tests for a case to be labeled as positive. So the first test is a screening test for a specific gene of nCoV-19, and the second one is again a RT-PCR based test that's used as a confirmatory for the second gene.
All right. And so usually if we talk about it, how long would this process take? Because, patients who have been diagnosed with it are being in quarantine for more than about 2 weeks.
Yes. So the first screening test would take from 12 to 24 hours depending on the bandwidth of the laboratory, and then the second test again would take that long. So I would say 12 to 24 hours would be the ideal turnaround time for the first screening test to give a report.
All right, keeping that in mind, so almost takes about 24 hours to start off with and go ahead with it. One last question, Arjun, if you could mention that, though there are government centers, the government is trying hard. The airports have been packed up with various kind of, screening services, and the health management and the health analysts are also looking into this particularly. But on the side of being private labs, have you put any kind of request to the government to also participate in this and analyze and help in detecting this, because currently it's only the rights are with the government?
Yes. So initially, after the 3 cases in Kerala, we were quite happy that it's not being reported further. But after the 2 cases that have been detected in Delhi and Telangana yesterday, definitely there are multiple diagnostic forums and bodies that are reaching out to the government and awaiting official guidelines to start testing, so that we can increase bandwidth and, more importantly, accessibility to the common man to get tested.
Right. If you could just mention of certain precautions that citizens could take, that humans could take around in order to probably be careful of this.
Sure. So the coronavirus spreads like any regular flu or a viral infection. So it's called as droplet infection. So someone who coughs or sneezes, it can be transmitted to the other person. What I would suggest is 2 things primarily to start with. First is a namaste over a handshake. So the traditional way of greeting people will help, because the handshake is the primary way the droplets get transferred to the other person. Apart from this, also, if you see anyone who is unwell, try and maintain a 3 feet distance from them. And also hand hygiene, so use soap and water to wash your hands regularly, and also alcohol based sanitizers can be used frequently. Also, if you're receiving any goods from outside the country, make sure you use a hand like a sanitizer to clean them before you expose your children to them. And also respiratory etiquette, so whenever you sneeze or you cough, it should be in a handkerchief with your elbow folded, so that you're preventing transmission of the droplets into the air around you. Also, you must curtail your travel unless absolutely necessary, and also you could use the N95 mask while traveling and when you visit any overcrowded places.
Right. Well, keeping those, I think, essentials in mind, we'd like to end this interview. Just one last concluding question, Arjun, if you could mention, is coronavirus something to be panicked about right now in India?
Sure. So I've been asked this question earlier, and I always believe that there's a very thin line between worrying and panicking. So worrying is good, it makes us more careful, but panicking is not what I would advise. But staying alert, making your friends and family aware is definitely what is advisable right now.